A super hot topic right now is pain control during an IUD insertion. I'm Dr. Monica, board certified OBGYN and mom of 3, and I want to go through some of your options that you can talk to your doctor about to help control the discomfort and pain that comes with having an IUD inserted. Any topic in medicine that involves pain is very difficult because studying pain and doing research studies on pain is so hard because of how different everybody perceives pain. And that is absolutely applicable to this area of pain control. So IUD insertions in the office. Any OBGYN is going to tell you that we will place some IUDs in some people where it is no different than a pelvic exam and they report very minimal pain or discomfort. And then we will have people who report extreme pain and say that it is worse than having a baby and maybe can't even actually tolerate having it done because it's so painful. And then everything in between those two ends of a spectrum. So it's very hard to predict who is going to be more towards one end or the other. There are some risk factors for perceiving more pain, such as if you have a history of painful periods, if you have chronic pelvic pain, if you have pain with intercourse, or have historically had a hard time tolerating pelvic exams. Those are some indications that you might be someone who perceives more pain with an IUD insertion. And now when it comes to methods to treat the pain or try to prevent pain in IUD insertion, the water's still really muddy because the research along with that is mixed or conflicting, and it doesn't really give us a good firm guidance of this works, don't do this, like this is okay. It's a little bit hard. So this is just a rundown of things that you can ask for and that are generally options to help reduce the pain with an IUD treatment. So step number 1, I think everybody should have an NSAID on board. So an NSAID is a non-steroidal anti-inflammatory drug. So these are things that are often over the counter, things like Motrin, ibuprofen, Aleve, Advil. They're all the same kind of medicine, Aleve and naproxen being the same, and then Motrin, Advil, and ibuprofen all being the same medicine. So these work by decreasing inflammation, and they work better for cramping type of pain, which is usually the type of pain that is associated with an IUD insertion. Now, interestingly, on ACOG's website, ACOG is the American College of Obstetricians and Gynecologists, they actually state that there's not been indicated to be an improvement in pain when you pre-medicate with NSAIDs. However, patients who come in for an endometrial biopsy, which is a biopsy of the lining of the uterus in an office visit, are shown to have a benefit from using an NSAID ahead of time. So it makes sense to extrapolate from that an NSAID should be helpful for IUD insertion, and also it will likely help with some of the residual cramping that is still there after it's placed later in that day. Additionally, NSAIDs are very low risk. As long as you don't have a contraindication to taking NSAIDs, it makes a lot of sense that there's a high chance of benefit and low chance of risk to go ahead and take an NSAID about 1 to 2 hours before your appointment. So NSAID is something that pretty much anyone who doesn't have a contraindication should go ahead and take before an IUD insertion. Next thing that can be used is something called a Lidocaine Cream. So this is just like lidocaine you've heard of from injections and other sources. It's a cream that can be placed on the speculum and placed in the vaginal mucosa to help numb the area. Now, it doesn't have extensive numbing properties, and again, it's not shown to be significantly beneficial, but this can reduce some of the discomfort. The next step up would be a Lidocaine Spray, which is sprayed on the cervix to provide some of that numbing effect to the cervix itself. Now, the downside of this is that it doesn't work right away. So if you want to have this done, you'll have to have a speculum placed, spray applied to the cervix, speculum removed, and then wait about 3 to 5 minutes, place the speculum again, and then go ahead and do the procedure. So certainly if you want to have that numbing spray on board, that would be something that you can do. Just be aware that it does take a little bit of time and you may have to have a speculum inserted twice. So another option that we have is what's called a Paracervical Block. This is when we take lidocaine and actually inject it via needle, both on the surface of the cervix and on certain spots on the side of the cervix to attempt to block those nerves from sensing the pain of the procedure. Now, this definitely has some downsides to it because the amount of lidocaine that should be injected to do a good block is about 20 cc's. And 20 cc's is 4 of these syringes amount of fluid injected around the cervix. So that's a pretty good amount of fluid that needs to be injected into those tissues to provide that block. So what does that mean? That means that there is a good chance that the block itself will be painful. Now, will it be less painful than the insertion? It may be, but there's no good indication via research or evidence that it's going to be like completely wipe out the pain of the IUDs So it's one of those things where it may work great. It may be worth the discomfort of the block. It's different for everybody. Now, another option to help with the pain of the procedure is more for someone who is having a lot of anxiety about the procedure, and that is to have a pre-prescribed medication of an anxiolytic. So this is a pill that's taken before the appointment that reduces the anxiety and helps provide a little bit of a sleepy sensation and help you get through having the procedure done. This is something like a Xanax or a Valium. Now, the downside of this is that you cannot drive or likely be working when you're taking that type of medication. So you would need someone to drive you to your appointment, drive you home, and you may have to be out of work or whatever else you were doing for the rest of the day because you took the medication. Whereas if you didn't take it, you can go back to work and drive home and go about your normal day after having an IUD inserted. Now, in someone who has maybe tried some of these options or declined some, and unfortunately the insertion still is just not possible because they're not able to tolerate it, maybe someone who we need to do a step up in regards to their treatment and provide some form of sedation. This is different based on different offices, what they provide. Some outpatient offices will have certain days where they have like a CRNA or someone who does anesthesia services come to their office and do outpatient sedation, which would allow the patient to be sedated, have the procedure done, and then of course go home with someone who's able to drive them. Not all offices can do this though. So the alternative would be, and what we need to do where I practice, would be to actually go to the operating room to utilize the anesthesia services to provide that sedation, to allow them to be completely comfortable, relaxed, not feeling the procedure, and have it done. And then one step up from that is to actually go under general anesthesia, which is not usually needed for an IUD, but sometimes is done if we're having other procedures done as well. Something that I will often do is someone who, for whatever reason, we are planning to do a DNC or a hysteroscopy, in which case they would go to the OR and be either fully sedated or actually under general anesthesia, would be to go ahead and place an IUD once I'm done with that procedure as well. So these are some options to treat the pain that's associated with an IUD insertion. Unfortunately, there's very mixed data and mixed literature about what things work well, what things consistently work for a lot of people, and it's really a very individualized treatment plan. So when you're thinking about these things, consider the benefits of these different forms of pain control. Consider that they may or may not work based on our research so far, and consider the possible side effects. So one of which being, when we do injections, that those have pain with them as well. So the best way to go about thinking about these options is just to go through each one, consider the risks and the benefits, talk with your clinician about you as an individual and what you think would work best for you to help make this experience as comfortable as possible. There's no guarantee that we can take away all of the pain. There's no guarantee that any one option will work, but all of these are very reasonable options for anybody to try if you want to. And just having a good conversation about yourself as an individual will hopefully lead you to a decision that helps you get through this process to get your IUD inserted.